The Bahamas hits a record-breaking 1,000 COVID-19 cases. Welcome to On the Record. I'm your host, Jerome Sawyer. On Wednesday, the Ministry of Health's dashboard revealed that just after 5 months of battling COVID-19, the Bahamas, a nation of less than 400,000, has recorded over 1,000 confirmed cases of COVID-19. Despite any number of efforts by the government and health officials to slow and flatten the curve, the inevitable has become our reality. While lockdowns continue, numbers rise, more islands are being added to the list of positive cases, and even more questions arise like, how do we manage this pandemic that seems to be out of control? How long do we remain locked down? And how do we begin the new norm without jeopardizing the public health of the nation? Tonight, on this edition of On the Record, we look at managing COVID-19, getting a grip on an out-of-control pandemic. Don't go anywhere. Our conversation begins on the other side of this break. The project really pays itself back.
Correct.
They set up
at the conference, the school.
As a journalist, I always have to focus on the facts, and sometimes that means going to investigate for myself. On the Record, Thursdays at 8 p.m. right here on RTV. Watching On the Record, our topic tonight is managing COVID-19. This week, the Bahamas reached a record-breaking 1,000 confirmed cases of COVID-19, and unfortunately, that's nothing to celebrate. It's been over 150 days of fighting the highly contagious virus known as COVID-19, and despite the copious efforts made to mitigate the spread of the virus, every day the numbers continue to climb. On April 12th, Cat Key, a surrounding key in the Bimini chain, recorded its first confirmed case of novel coronavirus. With over 7,000 tests already completed and over 1,000 confirmed cases within the Bahamas, Bimini and its surrounding keys allot for a little under 50 of those confirmed cases. That's a huge number for a little island with little over 2,000 residents. My guest for this segment of the show is one of the Family Island administrators with responsibility for Bimini and Cat Key, Mrs. Cleola Cooper Pinder. Thank you for joining us and being here on the record. Take us through what has it been like in Bimini since the first recorded case on April 12th.
So we started our task force on March 4th, actually. So we had a team, which was the medical team, immigration, customs, the chief consular, the Royal Bahamas Force. So we're having regular meetings as protocol for the island. So when we had our first case, we were able to put some of the methods in place that we had planned and strategized for. So we were basically a little bit prepared. We had our quarantine centers. The month of March, we have 3 quarantine centers that we've identified. We're currently working on, which is fully owned by the government, but that's not quite ready yet. That's pure rentals for our quarantine site.
And what has it been like for you on that island? You guys would have gone through a 2-week lockdown even prior to this. What has it been like for you now that you basically found yourself in the same position, for the second time as we now, as a country, go through this lockdown?
Well, luckily for us, we had a lot of support. Currently, we have a surveillance team here on the ground. We have the support of, I have 2 administrators here with me, and so the work is shared. It's been overwhelming sometimes, but persons, I guess we're a little, I don't know what I could say, but It's been overwhelming, and persons appear to be adhering to it, and then there are times when we have large gatherings. And so what has happened in the past few weeks, why there was a resurge of cases, is we had a number of funerals and a number of baby showers, and then there was a large gathering at one of the restaurants. And so we're trying to encourage persons. I know we're social beings and persons want to socialize, but during the season that we're in with COVID, we can't do that. We simply can't do that. And so our way of life has actually changed, but persons aren't changing with it. And so that's the problem here in Bimini.
Are people complying with the lockdown restrictions this time around? Are they complying with what's needed? Because you seem to have gotten it the first time with the 2-week lockdown.
Persons are complying, but when you have gatherings like the funerals or a baby shower, which really should not have, happened, or they should have practiced the social distancing, that's when we had the problem. But once we're on lockdown, persons comply.
Take
Like
us.
today is
Go ahead.
today is Thursday, Tuesdays and Thursdays, when persons stay, they have to stay in, they comply. Monday, Wednesdays, and Fridays, persons, they're allowed to go to the bank or to the food store, the water depot, or the pharmacy. And, persons use that as a time to get out and congregate. So, but persons for the most part are compliant.
What would you say are some of your biggest concerns on the island right now? I know that, during when you were sort of singled out for your own lockdown, there was a big push towards the food distribution and making sure you had what you needed. But, we're looking at it countrywide now with so many islands in the same predicament. What are some of the concerns that you all have right now? Some things that need to be addressed, or are they being addressed?
Well, the food distribution, the Red Cross is responsible for the food distribution through Rapid Bahamas. It's a process where you just register online, you receive a code, and then you go and collect a food parcel. Many persons needing assistance outside of that, we still have social services that can provide assistance. And so we don't have a problem as such with food because the food stores are open Monday, Wednesdays, and Fridays. And so persons who need help are receiving help, and if they need help, they can call. What I want to encourage persons to do is continue to wear your mask, because I find that if you wear your mask, keep your social distancing, wash your hands. I mean, the hygiene has to be paramount in this fight. I tell my staff, treat everybody as if they're COVID. They're COVID positive, and then we'll be fine. And so that's how we as administrators have been surviving, because we've been having to deal with the public. We've been having to deal with those who are in quarantine. But we practice, social distancing. We wear our masks all the time. We wear our gloves, and as soon as we get home, we take off our clothes and we go into the shower. So it does have to become the way of life.
I'm going to ask about your yachting community. Bimini is known as a place where folks come and dock their yachts, or they're out there in the harbor. What has been sort of the reaction to your yachters? Have they been coming on island? Have they been moving around? Have there been any concerns with that segment of the community?
So we've been working with the dock masters, and what we've asked them to do was to ensure that all dock masters have the thermometers so that they can test the persons when they come. Like I said, we established a protocol very early. So the dock master is the first person that would be in contact with the boaters, and so their temperatures are checked. They then take their documents to immigration, and then they're cleared. So we have seen a number of them on golf carts riding, through the community. But of course, we're on lockdown, so there's nothing open. But persons are still coming to Bimini. I guess, they prefer to be in Bimini. And then we have a lot of second homeowners as well that have slips right at the back of their homes. And so they haven't been interacting with the locals, but they certainly have been coming into Bimini.
Okay.
And of course, you make sure that the protocols are established. They have their negative tests. They have their travel visas, and their temperatures are taken once they reach the dock.
Well, that's encouraging to hear, and hopefully that's something that's happening throughout. We know that the first recorded COVID death was a resident in Bimini, or one of the earlier deaths, and it was declared posthumously. One of the critical concerns at that point was the transportation of that lady to New Providence and the time it took. Has that been worked out? Are the air ambulance services ready and available in the event that you have another COVID positive patient who deteriorates and needs to be transported, to New Providence or even Grand Bahama for hospitalization?
Yes, we have a massive support team with the surveillance, and so once a case is identified, we would call for the flight, and the flight comes in with the chamber, and that person is airlifted out. So we don't have an issue with that anymore.
Being such a small community, does that work to your benefit, or do you find that that's a setback for you? I mean, in New Providence, we've got lots of people everywhere. But what is it like for a small community in managing something like this?
I mean, managing the pandemic or
Yes, the pandemic, yeah.
Oh, well, like I said, we have a team. We established a task force very early, and so we share the responsibility and we share the load. If one area falls down, for example, we have a whole department in quarantine, then we'll get assistance from Grand Bahama, or we'll get assistance from New Providence. And so it's very easy to manage because we have the support.
Do you have all the things you need? Do you have the relevant PPEs for your healthcare providers? Do you have the things that we have in New Providence and other islands have in order to adequately address, the cases, even the test kits? Do you have all that you need on island?
Yes, we do.
Good news. And once a test is done, what happens then? Does it have to be transported to New Providence as well for confirmation?
Yes, we organize it. So we don't have any regular flights into the island. We would actually charter flights to take our swabs in just to make sure that, they get there in a timely fashion.
Mm-hmm. And what's the general condition of those who have tested positive? You're in the double digits, somewhere in the 50 area. What's the general state of the health of those folks who are still in the active cases column on the island?
They're all doing well. They're checked on twice per day by the medical team. And if they have any needs, then we as administrators would then attend to those needs. But everyone is doing well.
Okay. What is it like having to also manage the cat key situation? I mean, what was that like? Cat key would have appeared on the dashboard very early the last time. But what is it like? You've got the main Bimini, which in itself is split into two, but then you've got cat key as well.
Well, we have cat key and ocean key. Mm-hmm. So we have a good relationship with the general manager. And cat key has a rotation of private doctors that comes in every 2 weeks. And so they have a good relationship with the medical team here in Bimini. They keep us informed of everything that's happening. All of their positive cases, I'm told, have recovered. They had a very strict protocol as well. When we go onto the island, our temperatures are taken before we even get off the boat. The persons who are actually staying there have to be tested, and their test results come back by the next day because they send it off to the lab in the U.S. and they paid for a speedy or rapid response. So they have an excellent COVID-19 protocol on Cat Key Island. So both the general managers keep us informed of what's happening on the island.
That's good to know, and again, very encouraging. Mrs. Cleola Cooper Pinder, it sounds like, despite the high numbers in Bimini, you all seem to have it under control, seem to be, doing what is necessary to at least try and keep people safe. You would have mentioned that people are still gathering on those days when they're allowed to move around. We hope and pray that they get the message soon. We've been pushing, on this show previously that it's really coming down to individual responsibility, and we hope that those people continue to abide by the protocols. You all would have done what you needed the first time, and let's hope that, residents continue to listen and abide by the rules and the regulations, and hopefully you get through it even better than you did the last time.
Okay, thank you. Yes, I agree.
Thank you so much for joining us. Well, when we come back, we're going to be joined by the nation's chief in infectious diseases. You don't want to miss it. Stay with us. welcome to On the Record.
Looking for more On the Record? If you miss our Thursday showing at 8 p.m., join us for the re-airing on Friday mornings at 10, and then again each Sunday night at 8:30. Or go to our YouTube channel and catch up on all of our past episodes. And then like our Facebook and Instagram pages for a preview of upcoming shows and get a chance to ask your questions. Just look for On the Record.
Welcome back. Watching On the Record. Tonight we discussed managing COVID-19. I'm your host, Jerome Sawyer, and this segment is brought to you by Executive Printers. Within the last 2 weeks, a number of essential government offices have been closed due to COVID-19 exposure. Those include the Office of the Prime Minister, the Ministry of Health's headquarters, the Ministry of Education, the Attorney General's office, the Ministry of Works, and both National Insurance Board head office in New Providence and Grand Bahama. As if that were not bad enough, other entities like the Public Health Authority, Corporate Office, Bahamas Power and Light, Clifton Pier Power Station, and Water and Sewage's head office have all had to do the same. My guest for this portion of the show is Director of the National HIV/AIDS and Infectious Disease Program at the Ministry of Health, Dr. Nikkiah Forbes. So once again, Dr. Forbes, thank you for joining us. This time, joining us via Skype gives us an idea of where we have come in this pandemic and how things have panned out. Even, for everyone's safety now, this is the way that we have to communicate. But again, thank you so much for agreeing to be a part of the show. We are currently under a lockdown, heading into week 2 for the most part, or coming almost to the end of week 2. But yet we still see an exponential rise in cases. Help us to understand what's happening.
It's always a pleasure to be here with you, and thanks for asking me to come on so that we can talk a bit about what's happening with the COVID outbreak in the Bahamas. So as you said, we are going into the second week of our 24-hour curfew. So keep in mind that when we look at what's happening with the new cases that are being reported daily, it may take up to 2 weeks or possibly 4 weeks to see an impact on these measures that are put into place. Let me explain a little bit more. When we think about the virology of COVID-19 or how a virus works, we know that for this particular virus, the incubation period can be up to 14 days or 2 weeks. And so we know that people who have COVID-19, they may not manifest symptoms until into that 2-week period. And they could certainly transmit COVID-19 in real time before any lockdowns occur. And so when you look for the benefits of these measures that you put into place, it may take a period of time before you see a definite improvement. Those people, say today is Thursday, they could have been infected more than 12 days ago on the Sunday before the lockdown, for example. And so it's not unexpected that we would still be seeing a surge or an increase in the number of cases, but we hope that we will see a decrease if restrictive measures are doing what they're supposed to do, which is to stop people from mixing with other people. But that's a key part. So you can put in place measures, but remember there's some leeway to go to supermarkets, banking, and if people are not following the restrictions and the public health instructions, the virus will still continue to spread.
So 2 things out of that explanation. Are there any indications that we will go into a further lockdown or an extension of the curfew as we get to the end of this current state? We would have seen an extension for Grand Bahama. And secondly, there's been a lot of criticism about those lines at the grocery store, at the petrol station, at banks, etc. People saying, we're locked down, but yet we still have to interact in such long lines, and there's still large groups of people. Is that helping any?
Okay, so the first thing, we look as public health officials at what we call the epidemiological curve. That's the number of new cases that are reported daily. If you've been watching the Ministry of Health press conferences, you will see that we're also summing up the number of cases per week to look at this curve to see if it's going up. Is it remaining stable? Is it coming down? That helps to guide us when we make recommendations. about whether or not there's an impact or there isn't an impact, and do we need to continue all of our efforts to stymie the spread. And so it is possible, if we're still seeing an increase in cases, if we're not seeing the curve flatten, that health officials will look at this data and recommend that we continue the restrictions in terms of the movements of people. Unfortunately, that translates to a curfew or a lockdown. As it relates to the other part of your question, yes, Grand Bahama did go into an extended period because we were seeing an increase in the number of cases in Grand Bahama still. Reminds me, what was the second part of your question?
We wanted to know about the long lines, people at the banks, petrol stations, grocery stores, people lined up, on the days that they are open. And there's a lot of criticism from the public on that, saying, well, if we are under these restrictive measures, but yet we are still interacting in very large numbers on the days and during the times we are allowed to come out. Is that really helping? Is that not defeating the purpose almost?
Yes, I hear what you're saying. Here's the challenge. The population of the entire Bahamas, it's about 400,000 people. It gets difficult when there is a 24-hour curfew because people have needs. They have food needs, medicine needs, water. There are some essential things that need to be done. So how does one stop a person's ability to be able to get food or medicines for a 2-week period or longer? So there had to be a necessary compromise so that people could get their necessities. That being said, it had to be balanced with precautions so that mixing and movements of people were still somewhat reduced. And that is what the competent authority did when they allowed for days where people can get the items that they need. But it does get very, very challenging because it relies on persons also doing their part. Do you know what I mean?
Which I was going to bring up. People complain about the lines, but don't we all have a personal responsibility that if you're in that line or if you have to go out, to continue to do the things that health officials say that we should be doing?
Right, exactly. So you hit the nail on the head. Try to plan your supermarket shopping. Try to have one person go. Try and space it out. Try to get all the items that you need and plan for what you will need to try and prevent multiple trips to the supermarket. And I would say try not to take advantage of it. So certainly there are people who are aware that on certain days there can be movement to get essential items, but can take advantage of this for other things. And what it boils down to is our individual responsibilities. If we're still mixing, if we're doing unnecessary movements, the virus will continue to be transmitted from person to person to those people who are susceptible. And so it is all of our responsibility.
A number of businesses, government ministries have had to close for deep cleaning after there has been the announcement of an exposure to COVID-19. Is this completely necessary, and is this the way forward as we have a number of essential services that have had to be closed over the past 2 weeks as their operations have been impacted? So every time there's an announcement, there's closure and deep cleaning and people are sent home. Is this, is it necessary, and is this going to be the way that we're going to continue to function?
Thank you. So those closures are out of an abundance of caution. Let's drill down into that for a moment. So if someone tests COVID-19 positive in a workspace, there are workplace guidelines that have been put in place in collaboration with the Ministry of Health in terms of what could be done so that you can inform persons who may have come into the building and let them know there could be a potential exposure. And so you can know how high risk the exposure is and give them guidance. As it relates to cleaning, this is out of caution because we know that COVID-19 can live on certain surfaces for some time, hours to days in some cases. What scientists don't know is whether or not this is viable virus or is it live virus that can cause infections in other people. And so after there have been reports of COVID-19 cases in certain spaces, out of an abundance of caution, the space is cleaned bleach and water solution, for example, it doesn't need to take days. It can be after a few hours. I don't imagine that we're going to be doing this forever as it relates to COVID-19, but it is an abundance of caution right now. And I think that we do need to look at the practicality of that. It doesn't have businesses closed for hours and hours. It can simply be cleaned and reopened in a few hours the next day.
So, if you can to walk us through, once a person is found to be positive in the workplace, what should happen? What's your level of risk as the co-worker being in close contact versus just being in the building? I mean, the person is on the third floor, I'm on the second, or let's say we're in the same office space. What is my level of exposure as a co-worker?
That's a great question. So we could be talking about that all the rest of your program. So the Ministry of Public Service put on a webinar where I was speaking about it about a week ago in terms of what you could do to make COVID-19 adaptations in your workplace or make it a little bit safer at work. And I think there will be another opportunity next week, Monday, where we will be putting on another webinar about this. But when we talk about risks in the workplace, we have to remember that we are in a global outbreak of COVID-19. There are COVID-19 cases in the country. And so as persons get COVID-19, they may come into the workspace with COVID-19. And so we have to look at precautions to generally make the workspace safer. And there are many precautions. There could be screening. You could reduce the amount of people in the office as far as possible. You could put up plexiglass. You could have hand wash stations. You could keep registers so that you know if you hosted a meeting, or say you in your show you have guests. You could keep the list of the guests that came and where they went and who they interviewed, so that if there were a problem, you would know, okay, Dr. Forbes was in the studio on Thursday morning, and she may have had an interview with somebody who later got diagnosed as COVID-19 positive. So you could pull up that information as need be if there is, in fact, someone who gets later diagnosed with COVID-19. So let's talk about the risks for contracting COVID-19. So we know that it's more likely if you're in close contact between 3 and 6 feet with that person. If you have a significant interaction that lasted for more than 15 minutes, you were not wearing a mask, they were not wearing a mask, you were in a closed space, there was a crowd, for example. And so I'm saying all of that to say that there is a context when we think about who was exposed to COVID-19. If your colleague gets COVID-19 and you know that you sat and had lunch with them for about an hour and your mask was off, then we would consider you a high-risk exposure. However, if you work on the first floor and that person works on the third floor and you did not come in close contact at all and you wore your mask at all times and you kept your social distance and did hand washing, then you should have a relatively low risk. And so when we adapt and put in place recommendations and guidelines for workplaces, what we think about is reducing the risk in layers so that persons can work separately, as far apart, that they're wearing masks, that there's hand washing, that there's screening before coming into offices. And again, all we can do is talk about risk mitigation and reducing the risk as it relates to COVID-19, because as you can see, 20 million cases of COVID-19 worldwide, we know we're going to be grappling with this for a while. And the sooner we learn to live with it and practice precautions, is the safer we'll all be.
Before we take our next break, if you are sent home to quarantine, please explain to folks what you should do. I know of instances where people have been sent home to quarantine and they've done all kinds of craziness still. What should you do when you are sent home to quarantine?
Good. So quarantine, it implies that you have come in contact with someone who could be infectious, an infectious agent, or you have a risk for being exposed to this. It could be that you came in contact with someone who's COVID-19 positive. It could be you traveled back from a hot spot. So the person is healthy. They haven't developed any disease or infection yet. However, what we are doing and recommending in the case of quarantine is that the person is placed into a place where they are alone for the incubation period. Again, that's 14 days for this particular virus. And we are watching to see if the person develops symptoms that are compatible with the infection. Are you going to come down with the infection while you're in the quarantine period? Not everyone who is exposed will get the infection. Some people will. And so it is out of precaution, because for this particular virus, we know that some persons can be asymptomatic, and asymptomatic people can spread COVID-19. So while you are in quarantine, there are some things that you should be doing. I'm going to talk about that. You should stay in your own room as much as possible. You should ideally have your own bathroom and use your own bathroom. But if that is not possible, say you share a bathroom, you could use the bathroom last. The bathroom could be cleaned afterward. Someone should bring food to you. If you live alone and someone could leave groceries or meals outside your door, for example, you should not visit persons. You should not have persons visit you. And that should be for the entire 14 days. So we hear stories of people in quarantine who are not staying alone, that they're going out and doing their errands, that people are coming to visit them, that they're going to visit other people. And that gets very important when those persons later get COVID-19. We can go back and see that these persons that they visited, people who came to visit them, they are in fact getting COVID-19, and it's being transmitted. So it's really, really important to keep the quarantine instructions and follow those instructions.
Very good advice, and I mean, we have the numbers there to show that clearly some people weren't doing what they should. Dr. Forbes, we're going to take a break in our show, but we're going to come back and continue our discussion. To our viewers, don't go anywhere. Our conversation on managing COVID-19 continues right after this. Hello and welcome to On the Record, and the balanced, true and open debate you've been looking for. Welcome back. You're watching On the Record. Tonight we discuss managing COVID-19. I'm your host, Jerome Sawyer, and this segment is being brought to you by Grand Bahama Power. With the 2-week national lockdown scheduled to come to an end soon, this still does not mean that COVID-19 itself will go away. Here to help us understand better what is being done to manage COVID-19 is infectious disease specialist Dr. Nikkiah Forbes. Dr. Forbes, we've been hearing a lot about pharmaceutical trials, from medications being used for the prevention and treatment of COVID-19. Give us some details on these drugs. We're talking about things like hydroxychloroquine and remdesivir. Help us again to understand where we are with these drugs.
Yes, that's a very good question. So let's keep in mind that this is a new virus, and that means that there's no data on what therapeutic agents are going to be useful for treating the infection, getting the course of the disease to be shorter, and prevention at the outset. However, there are agents, some of which are investigational, others are known to scientists that could have antiviral properties that we're aware of. And so in the therapeutics landscape, we've seen a number of medications that have been put forward to potentially be used for the treatment and prevention of COVID-19. And when we look at where we've come from, we can see that there were a number of agents. Hydroxychloroquine was one of those agents. So were other antiviral drugs, for example, HIV drugs. And additionally, there were other antiviral agents. There was remdesivir, which did have some use in other infections like MERS-CoV, for example. There were steroids that were being discussed. There are newer agents that are monoclonal antibodies. Then we look at things like convalescent plasma. That's plasma from someone who did have it COVID-19. And so the basis of the use of some of these things is on their potential antiviral properties. However, we have to keep in mind that the basis of medicine is based on the best available scientific evidence. We practice something called evidence-based medicine at this time. What does that mean? Say you and I, Mr. Sawyer, are doctors. You say, I think that uh, agent X is going to be useful and shorten the course of this disease, and you try it out. And I say to you, no, I don't agree. Let's go with agent Y, and I think that this works better, and that this is the way it should be. And I may put my patients on that and see what kind of a benefit I get. But I may not be blinded. I may do some additional supplemental things to those patients that I have on those medications, give them a little more oxygen. There could be bias. So in an effort to get the best quality scientific data, what scientists do is something called randomized clinical control trials. So as simply as possible, this is what is done. Patients are placed on these therapeutic agents. It is best if the investigator does not know what those agents are, and the data is gathered so that we can see, is the disease course shorter? Do less people die? Do more people get better? Are their symptoms better? Do less people need ventilators? Do persons come off of ventilators faster? As you can imagine, it takes time to get that kind of scientific data. So since COVID-19 started, there have been a number of investigative trials that in multiple countries that have been done to see if there is a benefit of some of these therapeutic agents. So hydroxychloroquine and an antibiotic called azithromycin, that was used in some studies. However, the data, when we compile that data, it does appear as if this does not get people with moderate to severe COVID-19 better. It doesn't make them live longer. It doesn't make them have a shorter course of disease. And there could be adverse side effects. So unfortunately, there's no evidence at this time that that drug will work.
Are we using, or what kinds of drugs are we using here in the Bahamas to treat our patients, the ones that are hospitalized?
Okay, so let me finish.
Oh.
So then there is the agent remdesivir, which was shown in clinical trials for those people who have moderate to severe COVID-19 to shorten the course of the disease. They were sicker for less time. Then in the United Kingdom, dexamethasone was used for people who needed oxygen, and that seemed to have had a clinical improvement. We're looking at some newer agents, one that is still in clinical trials that may be helpful. And so doctors and scientists look forward for this information to be finalized. Remember, some of these agents are still in clinical trials, and we follow the best practice guidelines for the use of these agents. Now, I'm going to get to your other question. Which agents are we using? So what we do is we use the best practice guidelines. That is the World Health Organization treatment guidelines that was updated at the end of May, and the Infectious Disease Society of America guidelines. So what these guidelines do is they compile all the available data with expert opinion to say, shall we go ahead and give this in the sickest patients, or is there no evidence it's not recommended at this time? So we are following those protocols. So remember, people with COVID-19, the challenge is quite a few of these people have difficulty breathing. They have shortness of breath. They have low oxygen levels. They need oxygen. They can get a pneumonia, a very bad lung infection, which requires antibiotic therapy. Some of these patients will get blood clots. They will require blood thinners. Some of them may have low blood pressure and need supportive care and IV fluids, fever reducers, and symptom reducers. So those are the cornerstone. And then we look at some agents for the sicker ones like remdesivir and steroids. And so we may use those agents based on the Infectious Disease Society of America guidelines for those sickest patients. So that's what we're doing. We are following the best practice guidelines.
I've got to ask this question just because it's being sort of bandied about in some circles, and I've seen it discussed more and more. But there is a thinking, or there is a movement that we are doing some kind of vaccine clinical trials in the Bahamas. Can you confirm if that is happening, and if there is any connection between those trials and Bill Gates?
Yes, I've seen that clip, and we are not doing any vaccine trials in the Bahamas. And we, at the Ministry of Health, where I am an infectious disease consultant, are transparent and seek to make information available for everybody. So there are no clinical trials of vaccines going on in the Bahamas. We are not looking into any vaccine trials. We have no enrollment sites, and I don't know that there is any intention to do so.
Okay.
And I encourage people to get to know the facts, because
I just had to ask. Just this week,
an outbreak virus when there are these.
just this week, Russia announced that they had a vaccine as well. What has been the response from the global medical community to this announcement by President Vladimir Putin and the experts in Russia?
I saw that a few days ago. It's relatively new. So again, vaccinology, it's a specialization of medicine. And so what we look for is we look forward to facts and evidence. So we want to know how efficacious is the vaccine. If I give you the vaccine, does that mean that you're not going to get COVID-19? In what percent of cases? All the time? Let's look at the flu vaccine, for example. I could give you the flu vaccine. I could tell you there's cross protection. You may not get another flu next season, that it has a 50 to 60% protective rate. These are the adverse effects of the vaccine, for example. And so political leaders can say things, but scientists, we speak science and data and facts. So that is the best quality way to practice medicine and preventative medicine too. We look forward to hearing how efficacious the vaccine is. I haven't heard anything about that just yet.
I want to just touch on the lockdown again before we go to the break. Is there a plan being developed for the way forward that does not involve having to go into another lockdown or curfew? Is there a plan to get us forward that does not keep us in the same place?
That's a great question. I love that question. Let me try and explain. So no scientist wants to have to recommend a 24-hour curfew. On one hand, we know that COVID-19 is not going away. We will be doing this and battling this virus for a while. There are, like I said, 20 million cases in the world. We know it's highly contagious. We know that there are going to be people from all ages that will not do well with COVID-19, that will get very sick. Some of those persons will die. That means that how do we live with COVID-19? We have to try and prevent persons from getting it and having a surge in cases. So if you have a population of 400,000 people who have no immunity, if there is no vaccine, if there's no way to prevent it, so far we don't have a vaccine, if people continue to mix with each other, eventually everyone may get COVID-19, or a whole lot of people could get COVID-19, 80% of the population. This is what we aim to do when we put in place recommendations, from the simplest recommendations to wear a mask in public, keep your physical distance from other people, avoid mixing with other people and unnecessary movements, avoid crowds and closed spaces. What we're trying to do is prevent the infection from spreading. The challenge is when you have a lot of people infected and the virus spreading at an alarming rate or exponentially, many people are sick at the same time. And so there's going to be a burden on the healthcare system. If you have, say, for example, if you have 200 people get COVID-19 one day, Where are the sickest persons going to go? Remember, your health capacity is the same. You have the same number of doctors, nurses, the emergency room, these COVID beds. You won't have a place to accommodate those patients. What we know so far is that if we could do supportive care, if we could get you on oxygen, maybe you can ride through this with your own immune system. But if our health system is over capacity, we simply cannot treat all of those patients that are presenting. And that equals people dying, something we never want to see happen. And so, what we do is we rely on all of us. This is not one person's responsibility. This is not the Ministry of Health's responsibility alone or one particular person. We have to rely on our individual and collective responsibility to do what's needed to reduce spread. Now, that being said, we all have a free will. We can see that some people will not follow those instructions. They'll go out, they'll go to parties, they'll continue to mix, they'll go to 3 restaurants in one night, they'll jump on a boat and with 10 people and go out. So, you know what happens? The virus spreads. Now, what does a health official do? We know capacity. And so, if people do not follow the restrictive guidelines, if we look at the epidemiological curve of the virus being reported every day, and these cases are going up and up and up, then we've got to put in place some mandatory things to prevent all of these people getting sick at one time in the healthcare system. This is what a lockdown is. So let's look at where we came from in the last 2 weeks. We saw a large number of cases on some days, 40 and 50 cases. We saw Grand Bahama was having a problem. We know that Grand Bahama, unfortunately, was badly impacted in the last hurricane, and the infrastructure and the hospital there is less than perfect. And so that means that you have to put in place certain measures so that you can try and reduce transmission. We have to do the same thing on other islands and countrywide if we see that there is a problem countrywide. And we have to try and mitigate when we know that there's going to be a problem, when we know that there was a lot of travel and that other places are at risk. So none of us enjoy having a lockdown, but you know what it boils down to? We want to save lives because when too many people get sick, we cannot treat everybody. And so that is what we're seeing. Again, we don't want to live like this forever. We cannot live like this forever. So the sooner we start following the instructions so that we can live with this virus that's not going away, the easier it'll be so that there can be fewer cases. So if the cases are few, you have 1 or 2 a day, you have a few cases that are below the capacity of the healthcare system, then we can take care of those persons and get them better. So that's what it boils down to. But if you see that the cases are growing exponentially, you really got no choice. Remember the last time I was here, I said to you that it would be inevitable that we would have to have a lockdown if there was a surge in cases.
And here we are. Dr. Forbes, we're going to take one more break and come back with our final segment. But something you said was so poignant, individual responsibility. And we continue, I think, sometimes to miss out and misunderstand what that means to us. We all have an individual responsibility. I'm so happy you said that. Very sobering response. I think that really helped to put things in context. This is going to be with us for as long as it is, unless we do some things differently and continue to follow the guidelines. We've got more to discuss. Don't move. Our final segment is still to come. Hello and welcome to On the Record, a balanced, true and open debate you've been looking for. Welcome back to On the Record. This is our final segment. I'm your host, Jerome Sawyer. We're back with our nation's best in infectious diseases, Dr. Nikkiah Forbes. Dr. Forbes, during the first surge, the complete lockdown over the Easter weekend helped to flatten the curve. That's the information that we were given. Are we on track for the same thing this time around or not? If not, what's the difference that we're looking at now? That seemed to have worked the last time. Are we on track? If not, what's happened?
So in the first wave, we were able to flatten the curve. That took 15 weeks of measures. So there was the complete 24-hour curfew. We had a number of weekend lockdowns and other recommendations like work from home as far as possible and only essential services to be able to work outside of the home. So where are we now? It's still early days in the second wave. We are approaching maybe a week and a half into the first 24-hour curfew. We are still watching to see what will be the impact of these restrictive measures. Remember, I said that it can take up to 1 to 2 incubation periods to see the benefit of that. We do not know fully what will be the impact of that. We will have to wait and see what the curve of cases looks like as we progress through these measures. But I'm glad that you asked, because in this curfew, we have allowed for persons to get food and drug items. There still seems to be a lot of traffic on the roads. There is movement of persons outside of their homes. And so we're all responsible in terms of the impact that these measures will have on flattening the curve or not. So I say caution that
Yeah.
if there's a 24-hour lockdown, but people are still moving around and using it to visit homes of friends and family under the guise of going to the supermarket, then of course there will be a reduced benefit. So we don't know yet, to be totally honest. We'll have to see as the period progresses.
We hold our own futures in our hands. We would have seen this week in one single day the quarantining of the Prime Minister and Deputy Prime Minister. Are you able to speak to their level of exposure, and are they being tested regularly, or have they been tested?
I'm sorry, I don't have that information.
Okay, all right, good. Thank you. We'll continue to ask her. I've heard stories of people as well who have undergone testing, not quarantined, not isolated. Again, if you have taken a test, what should be the correct and safe protocol as you await the results?
It depends. So it depends on why you did the test, correct? So if you are having symptoms, you should be in isolation. That's a lot like quarantine, except you have symptoms that are compatible with COVID-19, and you should act as if you have COVID-19 until proven otherwise. So if you're in quarantine, you're certainly there because you're at risk for COVID-19. So if you are awaiting a test and you're in quarantine, you should still be in quarantine. You shouldn't be moving around. Now, in the private sector, there is the opportunity to do a test just because you want to know if you have COVID-19, or because you want to travel to some location where a COVID-19 test is required. You may have no symptoms, but you just avail yourself of the opportunity to do the test. You have no symptoms. So in that case, there would be no reason why persons couldn't continue their daily activities while waiting for the results.
If you suspect exposure and you have not been contacted through the contact tracing, because that's a reality as well, but you suspect it for whatever reason, what should you do?
The safest thing to do is to quarantine yourself while waiting the guidance of the contact tracers, or reaching out through the hotlines or their surveillance numbers to get further guidance, or you could call your own private physician, because it can have an impact, right? Suppose you live with your partner and children, for example. If you think or know that you've been in close contact with someone who's COVID-19 positive, then out of precaution, you could sleep separate, try to use your own bathroom and that sort of thing until you get guidance, or until you're contacted by the relevant.
Just this week, I would have seen a report in the United States that they have seen a 90% increase in cases involving children, many of them linked to the return of classrooms. Are you looking at what's happening in the U.S. with children as a model to address how we are going to now tackle this as we eventually send our kids back to school?
That's a great question as summer comes to an end. Here's the challenge. Children can get COVID-19. They can transmit COVID-19 to their classmates, to teachers, and those persons will go back into their homes. They could have an elderly parent or older parents, elderly grandparents. And so that's all that's needed for the virus to spread. Children can get sick with COVID-19 too. So as much as we want things to go back to what we used to appreciate as normal, from a scientific standpoint, you have thousands of children going to school every day in close quarters in classrooms. You could have smaller children who share toys and put toys in their mouth. Of course, it's a setup for COVID-19 spread. And so you really have to think that if you're having a surge in country or places, the best guideline may be to try and reduce children from gathering to reduce the spread. That I really would think that would be clear.
Best thing to do. Dr. Forbes, thank you very much for coming and sharing with us. Again, unfortunately, we're out of time. We can certainly have a much longer discussion, but we appreciate, as always, the great information and advice that you give us. And hopefully people who have not begun to realize their personal responsibility in all of this will take away the information from our discussion today and realize that the responsibility begins with each and every one of us. And as you would have said, it's not just the Ministry of Health, it's not a government, just the government, it's not any one particular group or groups, it's all of us. But it begins individually. And I thank you so much for stressing that in this discussion today, because I think so many times we're continuing to abdicate our responsibility to everyone else in this fight. But as you would have said, thank you so very much for coming on and talking to us.
Always a pleasure to be here with you. Take care.
You too. That's going to do it for our episode tonight, Managing COVID-19. Very grateful to my guest, Cleola Cooper, as well as Cleola Cooper Pinder, as well as Dr. Nikkiah Forbes. Special thanks to my production and technical teams for making the show possible, and of course to you, our viewers, for joining us again. Remember to stay up to date with the latest news and information on this network and on our nightly news, as well as our News Bahamas on Facebook. See you next time, same place, same time, right here on The Record.